Come to think of it, yeast infections may not look like a disorder that can have fatal or serious consequences to general health. That said, it definitely has the potential to disrupt your life. After all, who would want to live with an itchy vagina discharging white creamy fluid all the time? Time has come for you to know more on the causes of yeast infections. What you do for the vaginal area is one of the main reasons for the increase of yeast on the vaginal walls. You would be surprised to know that anti-inflammatory drugs used to treat bacterial infections on the vaginal area can possibly result in a vaginal yeast infection. At times, chemotherapy is known to result in increase of yeast on the vaginal walls. Did you know that vaginal yeast infection can also be caused when women report reduced immunity? Women having normal immunity do not report an increase in the amount of yeast on the vaginal walls and thus are immune from most yeast infections. How does an increase in yeast levels on the vaginal walls cause vaginal yeast infection? The logic is easy to understand. When yeast levels increase, they multiply on their own, further resulting in an invasion of the tissues in the vagina. This results in irritation on the vaginal areas. Knowing the causes may not always be good enough for you to cure yeast infection after its onset, but you could certainly prevent the onset of vaginal yeast infection after knowing how to prevent this nasty infection.